Suhail Bakur is a doctor treating COVID-19 patients in one of only 8 hospitals currently operating in Idlib.
This ICU is at maximum capacity. There are no empty beds. The pandemic has reached its peak. If the increase in cases continues at this pace, then in a matter of 2 weeks, the health sector here is going to collapse and will not be able to handle the pressure of the high number of patients.
Bakur says a comprehensive vaccination campaign is needed to slow the spread of the virus.
We need the people living in northern Syria to educate themselves and urgently take the first dose of the vaccine and consecutive doses. That's the only way we can slow down the spread of the virus and lessen the number of patients that required hospitalization.
More than 64,000 cases of coronavirus have already been confirmed in northern Syria, and the number of new cases is increasing rapidly, and more people are dying every day.
We are most affected by the young patients. Sometimes we have people as young as 28 that are on ventilators. We try and treat them for 5 or 10 days, and at the end, they die. This has a huge impact on all of us, because it means any one of us could end up sick and on a ventilator and die as well.
The majority of new cases are of the fiercely contagious Delta variant, and vaccination efforts have been slow. 800,000 doses of coronavirus vaccine have arrived in Idlib, but only around 50,000 people have been vaccinated. The Salvation Government, which governs Syria's northwest, has taken a number of precautions to slow the spread of the virus. But the Minister of Health says the ministry is not up to the task. Basic measures like mask mandates, school closures, and limiting of public gatherings are in place, but they're unlikely to be enough.
The only option we have in the light of our limited capacity to provide medical services, limited number of clinics, limited number of hospitals, and the lack of support from the World Health Organization is to try to slow down the spread of the virus so that the medical sector doesn't collapse.
Hussein Bazar says a military operation resulting in a large number of injured people, coupled with a continued increase of coronavirus cases, would cause total breakdown.
What resources do we have to respond to such a scenario? Our emergency services capacity is limited, especially in the hospitals, and so are our intensive care units. X-ray machines and blood banks are all being used in these conditions, and our resources cover only 50 to 60% of the needs. If there is a new attack and the pandemic continues to spread, this will be a huge catastrophe.
Convincing people in Idlib to follow preventative measures and get vaccinated remains an enormous challenge for local authorities. Obaida Hitto, TRT World, Idlib, Syria.